Good morning. Welcome to the 6th episode of Ask Giri, the Physio Show. Today's topic is how to prevent running injuries. Why this topic? Because I am sick and tired of treating injuries which is highly preventable. Especially this summer, I've treated so many running injuries which is totally preventable. But still people did what they have to do and then got injured and they're in pain and they are out of kind of running habits and they have to sit at home with a lot of pain. So that is why I thought we'll give some importance to this topic to let people know how to prevent it. Prevention is better than cure, isn't it? So that's what we're going to discuss in this episode. And hopefully you liked my last episode. We did pelvic organ prolapse in new moms and that we had very good reception for that as well. Okay, now let's get into this topic right away, right? Our body is an amazing structure, right? It has more moving parts than a car, but we take care of our car better than our body sometimes with regular services, and everything, whatever needs. Our body also needs more than that. So our body has this ability to adapt as long as the applied stress is not greater than the capacity to adapt, right? This is a very important concept everybody has to understand. Every active adult has to understand. Is it matching, right? Whatever stress you are putting into the body and his body have that ability to adapt to that capacity or not. If you are putting too much stress faster than it can adapt, you're going to have a problem. There is a mismatch there. So that's what we have to take care of. Overuse injury has a small kind of a formula. You can see it in the slide there. It is I is equal to N into F by A into R. So what is that? I is the injury to the tissues. It can be any tissues. It can be your spinal tissues, hip, knee, ankle. It can be anything, any tissues. How that injury happens and what is the formula for that is it equal to number of repetitions. How much running are you doing? And force of each repetition, how hard are you running, and divided by amplitude, right? Duration, and also how much relaxation, which is R, between your running protocols or repetitions. It's a small calculation, gives you an idea of what is more, what is less, and how is it causing the injury. Kind of give us a mathematical analysis of that. So long distance runners obviously have very high number of repetitions and also low rest in between as well. So it gives you an idea how to calculate that as well. The next one is, what are the causes? What are the causes of the overuse injuries, right? It's basically one word, misadaptation. Because I already told you about how our body has the ability to adapt and then injuries happen because of the misadaptation. So what are the causes of this misadaptation? Mainly just three: intrinsic factors, mechanical stress, and extrinsic factors. So what are those intrinsic factors we are talking about here? That's what you are seeing. Biomechanical stress, right, is loading happening properly in everywhere in the body, in your spine, in your hips, knees, and ankles. Or is inappropriate loading is going on? Are you putting equal weight on both sides? Because those are the important things. And how your thoracic spine is moving when you're running. How is your upper body movement when you're running? That's important. How your shoulders are moving. How is your head position? Is it way too forward? It's adding more stress to the thoracic spine, right? If you're a forward head runner like this, I've seen some people running like this, that's going to put more load on your neck and your thoracic spine. Then your thoracic spine is not going to rotate very well. If the thoracic spine is not rotating, you're not going to get that momentum for the pelvic rotations. And there are so many things are happening in your pelvis when you're running. Pelvis is rotating, pelvis is going up, there's a vertical displacement, and there is also rotating in its axis, it also tilting. There's so many things happening in your pelvis that depends on your thoracic spine movements, and how the pelvis moves is get affected. Then that's going to cause a different biomechanical stress to your hip and the knee and the ankle. So just a small example to let you know how the biomechanical stress causes overuse injury. Second thing is the muscle dysfunction, right? There are certain muscles has to work in certain ways for you to run efficiently. Are they all working efficiently, right? We have to find that out. And that's why you need to consult a running specialized physiotherapist or a physiotherapist who is a runner and also who has some certifications in analyze the running mechanics and some experience, and they'll be able to properly assess you and then kind of tell you what muscles are working properly and what is not. I did my course, running certification course with Running Clinic. They're the awesome organization who educate the professionals about how to assess, treat, and take care of runners. So I did the course about 10 years ago. Then it was very helpful. And some of the content I'm using in this presentation also some of the content from the Running Clinic as well. So I give that credit to the Running Clinic faculty and the organization. So muscle dysfunction we talked about. Next is the tissue frailty. How your tissues are moving, right? So we have layers. We have layers of skin, muscle, fascia, fat, and then we have the bone underneath and everything. They all have to slide and glide better with the good moisture in between, or intercellular substance in between. Good gliding has to happen because all your nerves and blood vessels are going through them, right? If they're not, they're dried out. If they're not moving very well, and we have very lot of myofascial stiffness, then we're going to have some problem when you do a dynamic activity like running. So those are the three intrinsic factors mainly causes overuse injuries or in running, right? The next one is the chain we talked about, right? The kinetic chain. When we talk about running, it's not like, okay, I'm going to run, I'm going to strengthen my glutes. You can't just do an isolated glutes exercise. You have to respect the whole chain, how it is working. For example, if your hip flexors are tight, that's going to inhibit how your gluteus are firing. So it's going to make your gluteus weak. So weak gluteus is going to activate more tensor fascia lata. That's a muscle in the side here, because the gluteus medius or gluteus is not working. So that other guy has to work more. And that's going to increase more tension in your iliotibial band. Everybody knows as IT band on the side of the thigh, right? That's going to cause a lot of compression forces where it attaches by the side of the knee, and you can have irritation. We call it IT band syndrome. It's basically a kinetic chain problem. Somebody's not doing their job, somebody's doing too much job, somebody has to pay for it. Very simple. So identify, correct, retrain, proceed. So that's what we have to do. As one small example, even a lot of people we find in runners, hip extension is quite limited, right? If the hip extension is limited, you're going to have problem. You're going to overact your hamstrings, and then that's going to have overuse injury for your hamstrings. As you know, you can talk to your colleagues who are runners or joggers. You can see hamstring injury is very, very common in runners because a lot of things come into play to cause you hamstring injury. We can actually just take the hamstring injury in runners as a separate topic and discuss that sometime later. And there's so much to discuss in why the hamstrings are overworked as well. So that's another thing you see in the slide there. And also stability. Quite a bit of running injuries happen because of the stability problem than the mobility problem. Hip stability is paramount, right? If you can't stand in single leg for about 20-30 seconds, you shouldn't be running that much because you're going to drop and you're going to create a lot of tension in the other tissues. And then hip stability is important for knee and the foot function. They are working together because they are in the same kinetic chain. So the problem is going to happen there. And so we have to take care of the whole kinetic chain. The whole point of this slide is take care of the whole kinetic chain, not just one muscle or the one joint. See how we move as a human being as a whole. That's very important because we are a special species, right? Homo erectus. We are differentiating ourselves from the other species in this world by the ability of long distance running. And that is why there are a lot of anatomical adaptations happen in our body just for the running, right? So we have short arms and long legs. We have bigger glutes. We have short and parallel toes. We have a very strong Achilles tendon. All these anatomical adaptations happen in this Homo erectus species just for running purposes. Are we efficiently using that? That is the question we have to ask ourselves for. Okay. Moving on to the next one is the mechanical stress. So remember that first we talked about the cause. Main is the cause for the overuse injury is misadaptation. For misadaptation, there are three factors. Number one is intrinsic factors. We just discussed that. Now, second one is the mechanical stress. Mechanical stress, lots of training errors, right? And we all know how we train. In this COVID situation now, most of the gyms are closed and very less people are accessing gyms. A lot of home exercises are happening. I'm very proud to see a lot of our clients are doing actively home exercise program, or if you're a runner, very sport specific exercise program. Sometimes we can be motivated or overindulgent. Sometimes we push ourselves too hard, or doing inappropriate exercises, or focusing on one group or one joint or one muscle. So that's not the way how you train, right? You have to see what is the biomechanics of your sport, and then you have to train functionally, sport specific, and also the dysfunction specific. Your dysfunction is your unique thing. So how do you identify that? You have to consult your physiotherapist to go through a complete assessment and then find out the dysfunction and correct it. If you're a runner, there's a separate format for the running assessment. There are a whole bunch of things we assess for the running and then go from there, right? That's how we do it. So training errors is the very, very important mechanical stress factor. The next one is physical demands of running too, right? There is a lot of demands. We call it terrible twos, right? There is too much running, or too soon, or too less, too fast, or too hard, and too less breaks and stuff like that. So terrible twos we call it. You have to try to avoid those terrible twos in there, and follow a good running program. It's always nice to have a company or join something, place called running room, or even leisurely by yourself. Just have a good program for you. Okay. Even a perfect candidate can also get injured. Okay, so it can happen to anybody. We just have to take care of it. Now we are moving on to the extrinsic factors. There's only two, right? Running shoe and surfaces. I'm not sure if you guys watched my episode on foot, your feet, your foundation, and that was my second episode, I think. If you didn't watch it before, please spend 20 minutes of your time, watch that episode, because that kind of links into the running and your feet as well. So it's on, if you want to access it, go to physioshow.ca. We have all the episodes are there. You can watch the foot episode there. So I have talked about the effect of shoes on the feet quite a bit in that. And here I'm going to touch up a little bit on that, because again, shoes and barefoot running and analysis of shoes and running, that's again a separate discussion. I can discuss that for a couple of hours actually. Shoes are good to prevent injuries to the foot, right? A thorn or a small piece of glass or a sharp stone or something like that. That's the only thing it's good for, right? Shoes, otherwise barefoot running is the best. And you can wear shoes, very minimalist shoes, and not too much heel or this control, that control, pronation control, supination control. Don't worry too much about it. There is no evidence for that, that shoe is controlling this and that. So your feet is already equipped with all those controls. Our feet is a marvelous architecture, and it has the ability to be as rigid as possible if it needs to be, and also as malleable as possible, and when it has to be. So most of the problems comes to our feet because we put the shoes on all the time, and even socks sometimes all the time, and indoor shoes and things like that we have to avoid. We have to let our feet breathe barefooted. Right. Running shoe also causes quite a bit of running issues. If the heel is too big, then it can increase the impact force to the other joints as well. There are so many things can happen by wearing an improper running shoe. That's why we are moving on to the very minimalist shoe possible, even for running. And let the foot do the thing, and it knows it is created for running and jumping. Okay, you don't need any extra support or additional things to make you run better. And the surfaces, right? What kind of surface you're running on? Hard surface, soft surface, irregular surface, dangerous surface. That has a little bit of, there is no relevance in research says, evidence says that if you run on hard surface that you're not prone to get more injuries than compared to running on the soft surface. What happens is how your body works running on the hard surface and the soft surface, that changes. Especially small tip is like if you run on the hard surface, your posterior chain is activated more. Your glutes, your hamstrings, your calf, your Achilles tendon and plantar fascia activates more. And let's work on the anterior chain, which is your tibialis anterior, the lower leg muscle, right? Where it causes shin splints and stuff like that. But when you're running on the soft surface, your stability is challenged. Your hip, ankle, foot stability is challenged. And then that is where you'll have a little bit of a more pronation happening in your foot, and all the stabilizers have to kick in more, and the push-off can be a little weak when you run on the soft surface. Those are the small differences in there. And running on a level surface all the time may cause some adaptation. That's why they say you run on the opposite side every other day kind of thing, to kind of change that adaptation of your body. And also you have to try to avoid dangerous running. Dangerous running means you have to be very aware of a quick change of surfaces. Those are the times where you get injured when you're running. Suddenly you're running from the pavement to the grass, or the grass to the gravel. You got to watch out the sudden change of surfaces. That's only one caution I would say here. So these are the two extrinsic factors: running shoes and surfaces. Next, moving on, prevention. To summarize, how do you prevent the overuse injuries, right? Adaptation. The cause is misadaptation. The prevention is adaptation. How you make your body adapt to the running, right? Fix faulty biomechanics. How do I do that? Get assessed by a professional, because it's hard for you to understand what faulty biomechanics you have. You may not have the professional eye, the observation and the knowledge to identify that. Go consult your physiotherapist to see what are the faulty biomechanics you have. Do you have a good head position? Your head is on the shoulder. Do you have good shoulder rotations or thoracic rotations or upper spine rotations? You have good pelvic rotations, pelvic tilts. Your core is engaging well. Your glutes is firing well. Your hamstring is working well. How is your hip, knee and ankle stability? How is your foot strike? How is your stride length? How is your cadence? And how is your foot strike? And where are you running? How is your ground reaction force affecting you? How much energy you are spending? How is your nutrition? How is your sleep? All matters, right? So, and also fixing muscle dysfunctions. So if you have some specific muscle is not working properly and somebody else has to work, and if somebody else has to work, they're going to have a problem because they're doing double job. They're going to get hurt if you're not trained properly. So that's why you need to fix the muscle firing patterns, the kinetic chain firing patterns, functional patterns. That's what you need, right? I'm not telling you to lie on your side and keep working on your gluteus medius by doing clamshell, 150 clamshell. Nothing wrong in isolated strengthening. That is just the beginning. You have to transition into a functional training. Okay, nobody runs lying on the side, right? So we have to do in standing, put a band around your legs or the ankle and I move. Like imagine a clock. For example, I'm giving an example of gluteus medius strengthening. You may start with clamshell, but very little. You don't even have to do clamshell. Put a band around your ankle or around your feet. Actually, research has proven if you put the band around your feet, it activates your gluteus medius more other than putting around the thigh or the lower leg. There is research for that. So I would advise you to put the band around your feet and you can stand there. Imagine a clock. You're standing in the middle of the clock. Just stand there. Then what you can do, you can, with the band around your feet, you go to 2 o'clock and come back and go to 3 o'clock, come back and go to 4 o'clock and come back, right? So that is more functional and instead of doing a lot of clamshells. So if you want to add a little bit of a more rotation to it, you can do it. Go to 2 o'clock and rotate, come back, go to 3 o'clock and rotate, come back, go to 4 o'clock and rotate, come back, right? You can do 3 sets of that and then you can counter rotate. Go to 2 o'clock and counter rotate, come back. Go to 3 o'clock and counter rotate, come back. Go to 4 o'clock and counter rotate and come back. So these are all more related to functional aspects of running instead of doing about 20, 30 or 40 clamshells every day with the band. So just a small example. This is just, you can do a lot of other training for that as well. Next, solidifying all the structures. Make sure all your structures are moving very well, right? So that's important. So next one is solidifying all structures, right? So make sure all your structures are working well, the whole kinetic chain, not just the muscle and joints. Your fascial system is important. Your ligaments and tendons are functioning well. Tendons can best function by loading them properly. That's again, tendinopathy in runners. That's again another topic. How to prevent tendinopathy in runners and how to manage that. That's we will discuss that. I'm planning to do that maybe next month for an episode. Just focusing on tendons, how to take care of tendon injuries. We might come up with another episode next month. So loading is the key. Eccentric loading is the key, right? You can't strengthen the tendon by anything else. That is the most evidence-based approach. Then be very progressive in your training, right? So don't right away start for about 1.5 hours and about 10 miles or things. Even if you're a beginner runner, start slow and progress slow, and your therapist will really guide you based on your abilities and dysfunctions, right? And appropriate running shoes. Again, don't go for all this fancy, you can't say I can only run in Nike X5 2500 or whatever like that with pronation control and heel lift and torsion control and also arch support. No, you have fantastic arch support, and if your arch is not good, you can talk to a professional to improve the arch. There are exercises you can do for that. Orthotics and shoes are not the only way to approach it, right? Selecting appropriate running shoe, minimalist running shoe with absolutely no heel as much as possible, and then that is the right way to go about it. And there are your charts we can help you with how to select your proper running shoe. If you have any questions, just give us a call. We can help you with that. Adequate surface, right? And mix it up based on what your need is, right? Some hard surface running, some soft surface running, so you can work on the impact moderation, work on the stability, and also some level surface on both directions. Those things can be achieved as well instead of running on the same surface all the time, right? That's very important. Next, we're going to talk about optimal performance pyramid. This concept is from Gray Cook from Functional Movement Screen. I'm a big fan of Gray Cook, and we practice quite a bit of FMS, we call it, Functional Movement Screen, in the clinic. We screen our patients using the tools, and we train them using the corrective exercises. It has given us beautiful results with SFMA and FMS, and also FCS, we call it, Fundamental Capacity Screen, that we do for the athletes and high performance athletes and the sports people, to measure your fundamental capacity of your body, ability to lift, pull, push, carry, jump, hop, all those things, and what is normal, where you are at, and how to go from where you are at to where you should be. So that is fundamental capacity screen. We're not going to discuss that here. Let's stick to this one slide to explain to you about functional performance pyramid. On the red one, you can see what is optimal, right? You should have a functional movement. You should have all your joints moving very well functionally needed for your sport. It can be running or any other sport. Then that has to be topped up by your performance, functional performance, which is your strength and endurance. Then on the top, your skills training, right? That should be the way it should be. Functional movement is the first foundation, then the performance, then the skill at the same level, right? Now you see what is overpowered. What is overpowered means your movement, you don't have enough movement. You may not have a good thoracic rotations, or you may not have a good hip rotations or knee extensions when you're running, but your functional performance is more than the movement. That means you have a great strength and endurance. You keep loading your muscle and pumping the muscle without proper movement. And we already talked about our first episode is, move first and then load later. Move well first and then load later. That's the concept of our first episode. If you haven't seen that, again, go back to physioshow.ca. It is there. So that is a concept you have to develop. You cannot load or strengthen anywhere if you're not moving that well first there. Okay. Then strength and endurance should not be more than your movement. And then skill is also overtaking your movement. That's overloading, overpowering right there. And there is also underpowering, right? There's a lot of underskilled athletes out there. And what is underpowering, right? Your functional movement is normal. You're moving very well, but your performance, strength and endurance and skill for that particular sport is very limited. Then you're going to be underperforming. So I want you to understand this concept for you to train. You can ask yourself where you're at in your functional movement, where you're at in your functional performance, and where you're at in your skills training and your skills for running. Do you know the right way of running, right? You can ask those questions. If you find that you need some help, go talk to your physiotherapist, right? So, and also strengthening. So every sport needs strengthening. Even forget the sport. I tell my patients, your job is your sport. Whatever job you're doing is your sport. How are you training your body for that? If you're not doing anything about it, I'm sorry, you're going to miss out and you're going to have some trouble, right? So with running, as I told you before, stability causes more issues than mobility. A lot of people we see the stability patterns, the stability firing is not happening. Stability is motor control, right? You cannot do strengthening exercises to improve stability. You need to do stability training. That's all motor control training. Ability of your brain to activate certain muscle groups around the joint for a given task in a given time. So that is your stability, right? So your hip, knee, ankle stability is very important for runners. If you don't have that, you're going to use the prime movers as stabilizers, and they're going to get overused and injured. So that's what happens. Or you can get sprains and strains and tendon overloading and abnormal loading causing tendinopathy and tendon injuries. Everything can happen just because of stability issues. If you're cycling, it's a different muscle group you're going to work on, right? If you're swimming, you're going to work on different stability, mostly upper body, scapular stability and shoulder work, and you're going to do more mobility on that area. So it depends on your sport, you're going to strengthen. Try to, as much as possible, avoid isolated strengthening. Try to be sport specific and functional strengthening, right? That is how your brain works. Your brain does not activate muscle groups. Understand that concept. That's a very important take-home message. Your brain doesn't say, okay, Giri, activate your biceps. No, brain never says that. If you want to lift something here, the brain activates movement patterns. Brain says, okay, neck and shoulder stabilize the shoulder, elbow, biceps has to contract at the elbow and the hand has to open. The whole movement pattern, the brain has to activate, right? It never activates one muscle group. So why do we train isolated muscle training if the brain is not functioning that way? Right? Just ask yourself that question. Simple thing to ask about. And just to summarize the injury prevention, warm up nicely. Warm up has to be sport specific. For running, stretching is not great evidence of preventing injury there. So warming up with your running mechanics, there's whole bunch of warm-ups we teach our runners, split the running biomechanics into small components and teach them as a warm-up. That's how we do it. And then proper running technique, that has to be assessed and corrected. If you're not, then avoid abrupt changes in your routine or orthotics or shoes and all those things. And proper shoes, minimalist shoes, that is the key here. And then you can see in the slide there, foam rolling. That is again overstated thing to do. A lot of people actually, in my opinion, they do too much foam rolling. And not all your tissues need so much compression forces. I think our lifestyle already gives us so much compression forces in the tissues. So sometimes the tissues needs distraction, not compression. So if you're overdoing your foam rolling, ask yourself why and consult a physiotherapist to get right advice, right? Rolling everything is not the right answer. I know people roll their IT band like crazy. IT band already, most of the issues in the IT band is because of the compressive forces going through the band. It needs distraction, not compression. If you keep compressing that IT band again and again over the roll and your body weight, you're going to have more problems in there. So it might feel good when you foam roll, but not all foam rolling and frequent foam rolling is good for you. Adequate rest and recovery is important, and also functional movement screening. If you're going to run, if you're a runner, or if you're already taken up running, or if you're going to start running, get yourself assessed first whether your body is ready for running. That's when functional movement screening comes into play. We assess the 7 important movement patterns and see what is missing, what is good, what is not good, and then give you the corrective exercises to work on it. Then you go do your sport, and then you can prevent injuries. That's why I told you in the beginning, I'm sick and tired of treating preventable injuries, right? When you can easily prevent and get well and then do well, why you have to suffer? You don't have to, right? So now moving on to the audience questions. We have a couple of questions from the audience. The first one is Donna from Edmonton. She asked that does the good stretching routine will help to prevent running injuries, right? I'm sorry to say, Donna, stretching does not decrease the risk of injury. Whoa, don't jump on me yet. Yes, that is right. That is evidence. It's not me who's telling you that. It's the research evidence, right? Stretching sometimes even increase the reason for injuries. I put the reasoning out there in the slide for you to know, because sometimes stretching a muscle in excessive range temporarily increases tolerance to pain. You don't want to do that. And also it alters its protection mechanism against elongation. So because of those reasons, you might also more prone sometimes. So stretching is a no-no. No, stretching can be done as a cool down technique. After you finish running, you can stretch just to cool down. That is where it's more effective rather than doing whole bunch of stretching before you run. Okay, I might have, made you think a little critically, but that is the truth. Okay, the next question is from Jeff from St. Albert. He asked, what are the evidence-based advice for the runners? So here comes my top 8 advice or take-home tips for the runners. Number 1 is surround yourself with the right people. What I mean by right people? Right physician who has a knowledge about your sport. Right physiotherapist who has a knowledge about what you do, how your body functions and what sport you're playing. And what are your goals? What are your running goals? What are your sport goals? Right? Somebody who's patient-centered and goal-oriented therapist and who's knowledgeable in functional assessments, functional treatments, and also running assessments and running-related injuries treatment. Right? There is so many common running injuries are out there, starting from the top to bottom, right? Let's start, if you don't want to start here, we'll start with the lower back pain, pelvic pain, hip pain, And you can have in the knee pain, you can have anterior knee pain, which is the front of the knee pain, lateral knee pain. You can have hamstring injuries, quite common, and calf injuries, calf strains, Achilles tendinopathy is very common, plantar fasciitis, metatarsalgia, the foot pain, heel pain, right, and arch pain. There is so much list of conditions commonly we see for the runners, and we can take care of all these things when you surround yourself with the right people, right? Your team has to be really good and a good support, right? The second point here is keep it simple. Don't make it complicated. Don't let anybody tell you you need this particular shoe for you to run well. No, you just train your body to do that, right? And then get out into the nature. Don't run in the same pavement every day. Get into the woods a little bit and be safe though, and not too dangerous, and change your surfaces a little bit and play with it, and you're gonna have a lot of fun in that one. And also remember, the third one message is body will adapt. Give yourself some time and play it safe, right? Our body and brain is amazing things. And another technical tip is number 4 is cadence, right? Keep your cadence between 170 to 190. What is cadence? Cadence is steps per minute, right? Like how many steps you're taking per minute. And try not to run too fast or else too slow. If you keep the cadence between 170 to 190, you can measure it, and then that is a good speed for you to steps per minute for you to do it. And also when you're running, keeping your heel, you're striking on the forefoot than the heel strike, and also keeping your foot under your center of gravity is very important. That is more efficient, and also it prevents a lot of injuries rather than have a very long stride and put your heel in the front quite a bit on the top, and that is not the right way of running. Again, just a tip about running there. And also very gradual warm-up and specific warm-up, okay? Again, as I told you, stretching is not a great warm-up. Split your running mechanics and do specific warm-ups and gradual warm-ups for your running purposes. That was your 5th point. And 6th one is, I would request you guys to spend some time barefooted at home, backyard, everything. That's the best thing you can do for your feet. And also strengthening your foot muscles. When you wear shoes all the time, your intrinsic muscles of the foot, the small muscles between your bones, you have like so many bones and so many joints and muscles in your layers of muscles in your foot. So the small muscles in your foot may not work at all properly if you're wearing socks or shoes all the time. So let them work. Yeah? You can do a proper strengthening by do a lot of small exercises. You can ask your physiotherapist about it, or watch my episode on about the feet to strengthen that intrinsic muscles of your foot. The next one is your routine, right? At least 4 times a week, you do some proper functional training and functional strengthening. It can be short. It can be 15-20 minutes functional training or sport-specific training for you, whatever is needed, other than just running. Keep that time for training other than the running part. So you need to train to run. So don't forget that. And last but not the least, nutrition. I forgot to add the sleep in that. You have to sleep, get yourself some sleep, 7 to 8 hours, put the phone away, right? And do not get disturbed with it. And don't stare at the phone 1 hour, 2 hours before you sleep. And that blue light is going to affect your sleeping patterns as well. So, and good food, good nutrition, water. Talking about water, you know what's the most common mistake people do, runners, with water? They drink too much. So oversaturation is also a problem. So drink adequate water, proper nutrition, take care of your good food habits, and some good nutrients, right? And the psychology, your mindset. Have a great mindset. Educate yourself, right? This is the whole point of these episodes, Ask Giri Physio Show, to educate and empower you, right? So that you can take informed decisions, right? Rather than just going searching in Google and YouTube what is happening in the world, you educate yourself, the right evidence, the right information. That's the best medicine. And then you can take informed decision. So you can have a calm mind, informed mind, and a joyful mind to go enjoy what you want to do in life, right? And also practice some mindfulness or meditation to calm down from all the distractions we have in this world and all the messages coming from all over the world, the TV, the news, the social media, and everything bombarded with messages. And filter it, take what you need, remove the rest, and then have a wonderful mindset for you to do whatever you want to do in your life. That's the message I want to give you guys here. And thank you for watching the episode 6, how to prevent running injuries, in this Ask Giri the Physio Show. If you find this informative, please like it and subscribe to the YouTube channel as well, and share it with your friends and your runners and joggers and whoever it will help. Okay, so I will see you next month with episode 7. I haven't decided the topic yet, but I will let you guys know soon. And thank you so much for catching at the episode with me. Have a good day. Bye. Adios.